All right, that was Congressman, the Democrat, David Scott of Georgia. The questioner was Dr. Brian Hill, a urologist. They're both here in the Situation Room right now. Let me introduce Representative Scott first. What was so wrong about his question, Congressman, that got you upset?
Because the people of Douglasville, especially the African-American community in Douglasville, through which a highway, an $80 million new highway, was going through their community. They set this meeting up. It was not mine. It was the people of Douglasville that did this. And because of their homes and their businesses, 65 businesses would be removed. It's going through a tunnel in Douglasville. It will come out on the other side. This is a big, big deal. And imagine yourself with your home and everything else in. And many of these people have felt that they've been disenfranchised before. That's what this meeting was for.
All right.
So that when the doctor knew it. He will tell you he knew it. And then I have a health fair coming up on this Saturday where we'll have all the healthcare providers where there will be. So when the Channel 11 ran that clip, they picked and edited out what they wanted.
Hold on a second, Congressman, because I wanted Dr. Scott to respond. Dr. Scott, what do you say to that point? This was a discussion about a highway, and you asked a question about health care reform.
No, I do agree with him, actually, and I won't disagree with him at all. It was a discussion about Highway 92. I had called Congressman Scott's office, and I had spoken with them beforehand, and I had actually asked them if they were going to be having a health care forum, and I was told no. So what I did is I went to the meeting. I waited 3.5 hours. They made an announcement at the end of the meeting. We understand people are here to ask further questions about topics other than Highway 92. If you have any other questions about 92, come to the microphone, please. People did. I went and stood at the end of the line. The final question about Highway 92 was asked. Nobody else was behind me. And so I stepped up and I asked a question about health care at that time.
And what was wrong with that, Congressman?
Well, the point was this. If the doctor was sincere and he had an issue with health care, he could call my office, 7 appointments, like all my constituents do, and come in. No, doctor, you asked when, hold on a second, your question was, when is Congressman Scott having a health care forum? And the answer was, as my staff said, he's not. That's a difference from the fact if you had a question about this. So you picked it up on yourself to come and take advantage of these individuals in Douglasville. Now, Wolf, what I'm saying is
let me interrupt Congressman for a second. But if your staff said if you have a question on something else and he waits in line till the very end and he had a question about health care, what's wrong with simply answering the question?
Because it was this. That issue was, do you have any more questions about the highway? I've got a tour waiting up for people to take me to show the impact in that community. Again, here's the issue. The issue was they knew perfectly well that these people spent months putting this together for a very disruptive highway. And so that was the general question. I felt I had to stand up and defend the people of Douglasville. And the other thing is this. This is an orchestrated opportunity here.
Let me stop you on that point, because Dr. Brian Hill totally disagrees with you that he's part of any orchestration, don't you, Dr. Hill?
It's 100% correct. I'm not orchestrating with anybody. I'm not involved with anybody. My father-in-law, who's 66 years old, whom I called that morning, and I decided probably about 1 o'clock in the morning on Friday night that I was going to go. I called him at 8 o'clock in the morning, and I said, hey, do you want to come with me? I just want to go. I want to sit down. I'll sit through this meeting, and I'll see if we can get some questions about health care in. And I sat through the meeting for 4 hours.
Here is the point.
Congressman, he is your constituent. He's a physician. He asked a simple question. I'll paraphrase the question. We'll get your answer. Do you support this public option, this public health insurance agency that would compete with the private health insurance companies?
And I answered that question, yes, I do. Every question he asked, I said yes. But I said why?
Why?
So you said, well,
why do you support that plan, that I discussed about, and I want to hear a good, educated
I will answer it for you.
Not talking points.
Okay, let me answer it for you now. I genuinely believe, Doctor, that the big problem in this is the insurance company and the pricing system that is there. They like competition. They have a monopoly on it. We need a form of an option here that will force some competition while at the same time providing an opportunity for those who the insurance company might not want to take, but having an opportunity. My final point is this.
How do we have a monopoly when there are multiple insurance agencies out there? And again, you're not even talking about how that is going to decrease costs.
Well,
you're just doing talking points. I mean, we need to talk. You're talking about a government subsidized option that I've already looked at. We've already talked about. We've looked at data. We've looked at facts. I've talked about the Massachusetts healthcare plan. We can talk about Canada. We can talk about, Europe. We can talk intelligently, but I want to hear facts and numbers and data and figures. And I hate to tell you, I'm going to say this real quickly because this bothers me a little bit. This is a health fair that you're holding on the 15th, and I'm a physician, right? And a health fair is where people come to go screening for diabetes and hypertension and prostate cancer and cholesterol levels. That's not a forum to go and talk about healthcare, to have people raising voices and having discussions.
But here,
and actually, somebody mentioned to me at the end of the meeting that day, they say, you know what, I heard that he's having a healthcare, a health fair that's on the 15th. And I said, you know what, that's not appropriate for people to go to that kind of meeting and stand up and cause problems when patients and physicians are getting together to try to do what's right for the community. So this is a health fair. This is not a health care forum.
May I answer you, please? Okay, Doctor?
Please do, though. Yes, I'd love to have an answer.
You very eloquently explained the complexities of this issue, the fact you wanted data and all that information. Mm-hmm. You live in the district, and you're a physician. Mm-hmm. Why not take the time to call your congressman and set up an appointment to come in where we can lay all of this out for you? Rather than come, hold on a second, rather than come on in a very, and the video didn't show the raucousness,
because there wasn't
the crowded,
there.
And
we
all
got the whole
of
video.
Listen, my friend, this was not for health care. That was the issue that rubs. This were for people whose homes are impacted by a road that's coming through that to destroy them.
Sure.
I owed it to them.
Americans.
No, but
300 million Americans that are going to be impacted by this health care plan.
And I
agree, Highway 92 is important. Not going to talk about how... Yes, okay, I want to talk over you. Sorry.
Okay, but all I'm simply saying, Doctor, and I don't want to talk over you.
Yeah, I agree. I'm sorry.
I want to make clear that on the tape, when I was saying, don't come in and take advantage of what these folks have done. That's what I said, because I owed it to them to stand up for them and respect the hard work they put for this. Their homes are going to be affected and destroyed. Businesses in this African-American community who has expressed a desire and a feeling of being disenfranchised. So here you all come taking advantage of that on a very controversial, complex issue that you know and I know full well it's going to take far more deliberation. I'm anxious to
let me let Dr. Hill respond to that.
In a Congress that works to bring people together.
And Dr. Hill, get back to the point that you're not part of any organized group, or you're not even a Republican, I take it, are you?
No, I'm not. I'm an independent voter. I actually like to look at data. I'm a data guy. I'm a physician. I live my life on data. As I mentioned to Congressman Scott, we practice medicine using what we call evidence-based medicine. We do research. We see outcome data, and we actually do and practice medicine based on those outcome data. So I'm all about outcome data. So that's why I looked at and spoke with data coming out, pure data, saying that this health care plan is not achieving what we want. We want to improve access to health care. We want to decrease costs to health care. And we're not seeing that happening out of the plan as it's being run in Massachusetts.
It sounds to me, Congressman.
Let me take this as an opportunity to extend an invitation to you, Doctor, that I would love to set up a meeting where you could come to the office. We can sit down. I'd love to have your input to let's work together on this bill. It's very valuable for us to work. But that's what I am very much after. I want to bring down the high costs of health care while at the same time expanding its coverage. That's a very difficult thing to do, and we do need your help, and I would love for you and I to sit down and see if we can't make some contribution to this.
Do you accept that invitation,
I would love to do that, but I will tell you, and the thing that I worry about, because I don't want this to be politicized, this is not a political issue. This is an issue that should not be politicized. This should not be along any type of ideology. This is health care. This is people's daily lives and their health. And I'm a little afraid that we go and we sit down and we talk, and there's nobody that's going to hold you accountable to what you say and what we talk about.
Well, let me make a proposal,
Congressman. That's going to be out there, and I just don't, and Doctor, so I don't need that.
Doctor, I'm a part of the force in Congress that slowed this down. I'm a part of the group in Congress that worked on this to make sure we bring down the cost. I'm a member of the Blue Dog Coalition that was a force that stopped this. I am interested in getting your points of view heard. I spoke with Obama to do this, and he agreed to do it. So please don't paint me in that corner. I want to work with you to make sure your views are expressed. You are a member of my constituency, and I would love to work with you on it, and I'd love for you to just set up and let's meet.
How about a nice healthcare forum?